is Jay Shorr, and I am the managing partner of the Best Medical Business Solutions, and we are a medical practice consulting firm specializing in the operational, administrative, and financial health of mainly aesthetic, cosmetic, surgical practices, but have recently branched off into multicultural medicine and regenerative medicine.
And my name is Mara Shorr, and I'm the Vice President of Marketing and Business Development for the Best Medical Business Solutions.
The fundamental business practices that most physicians should start with is having a plan. And it's very important to have a business plan, because if you don't have a business plan, you're planning to fail. And the main components of your business plan really should be your financial, your marketing, and your operational, and your staffing. And how you get your funding, whether it's private investing, angel investing, or the traditional bank funding, you have to have your plan in effect before you start, because you won't know where you're going if you don't know where you've been.
So we always equate a business plan to a roadmap. In other words, if you don't know where you're going, you don't know where you've been, but you also need to know how to get there, because you wouldn't start off on a journey without knowing exactly how to get there and without those driving directions.
Several mistakes that physicians make when they first open up a practice, as I stated before, is not having a proper business plan. The number two thing that physicians make mistakes on is not having a properly trained staff. Your key staff is fundamental to the success of your operation, because they are a representative of you. The next thing is not having the proper equipment and supplies to run your type of business. Never buy equipment hoping that you will drive the patients. You need the patient base in order to drive the equipment so that you can have a successful operation.
And I think to tie into the concept of what goes into a business plan, one of the top mistakes that we see physicians make is they don't have a plan in place as far as their finances are concerned and as far as their spending. So in tying in with everything that Jay had said, you really need to keep an eye on your finances and making sure that from the very start you're keeping an eye on that and you're keeping your finances as low as possible in the right arenas. So not necessarily cutting back on staff and not underpaying your staff, because then you're not going to get a high quality staff, but making sure you aren't overpaying for things, whether it be credit card processing, your supplies, your rent, not having a properly negotiated lease. So while that ties into a business plan, it really takes it to the next level, making sure that you keep a close eye on your finances throughout the duration of the time you have your practice, but really when you first start as well.
To tie into what Mara said, one of the major mistakes is you think you're properly funded. And as time goes on and you don't have the revenue to drive any profit, you then become underfunded, and you may have nowhere to go because you've maximized your potential of what you initially started out with from your investors, and it may be very, very tough to get refunded again.